You're watching CoastLife, and we know how important it is to take care of all the members in our community. And as the weather turns, you may be seeing a little bit more infection, a little more sickness, and we've got the experts in keeping people healthy and safe in studio with us today. We've got Christopher McLean with Peninsula Homecare. Welcome to the CoastLife Couch.
Thank you for having me.
We're very happy to have you. So we're talking today about something that a lot of people might not know about, and if they do, you unfortunately know about it, right? We're talking about sepsis. Before we even get into that though, if you could just explain to everyone watching your position with Peninsula Homecare and what you do.
So with Peninsula Homecare, I'm actually what's considered a clinical team leader. My role on day-to-day operations is I'm actually in charge of all the clinicians in the field. I also oversee all the patients, their activities, their statuses, when their next coming up doctor's appointments may be, and actually coordinate that with other facilities, such as hospitals or short-term rehabs and stuff like that.
Just like we said, we're talking about sepsis. What is it?
So sepsis is actually the body's natural reaction to fight an infection. So when you do get an infection, your body actually releases chemicals within your system to fight that infection. What happens is sometimes if too severe, your body will quit fighting the infection and start actually attacking the tissues and organs of your own body, causing widespread inflammation.
So when would you see something like that? Because I think, and maybe I'm thinking of something else, but when I think of sepsis, I tend to think maybe older adults, elderly, maybe they're in bed too long. Is that how that starts?
So there's a lot of different causes for infections, of course. You know, infections are widespread. Pneumonia is an infection, for one thing. In home care, most of the people that have sepsis usually get it from an undiagnosed urinary tract infection. So, you know, they don't pay attention to their own body. So as the further along it goes, it gets worse and worse. Their body then quits fighting it and then starts attacking itself.
Oh, interesting. I didn't know you could get
I didn't
from
either.
That.
So yes, always pay attention to your body. But if you are sort of in tune and paying attention, what are some of the signs that maybe sepsis is on the horizon?
So the most common signs and symptoms for sepsis in the early beginnings is, you have a low blood pressure, a high heart rate, you spike a fever, you start breathing more shorter breath or faster breathing. Those are your typical 5 symptoms of sepsis. It does have to be clinically diagnosed from a provider. You can't go talk to your neighbor and say, hey, this is what I have. They're like, oh yeah, you got sepsis. It actually has to be done from a doctor or a nurse practitioner.
And are those similar symptoms that people who are taking care of maybe an elderly patient or someone who takes care of somebody, what should they be looking out for if maybe the patient can't recognize the symptoms themselves?
So basically those 5 symptoms. The biggest thing that we like to teach people is know your own body. If you're not feeling good and it's lasting longer than it probably should, then you should definitely seek a medical professional.
Yeah, and are there some, preventative steps to prevent yourself from getting to the point of sepsis if maybe you do have an infection like pneumonia or, like you said, a UTI?
Yeah, there is. So, the basic things that we like to teach is proper hand hygiene. Make sure before you start touching things like your Foley or a cut that hasn't healed in 5 to 7 days, make sure your hands are clean. Stay up to date on all your vaccines. Manage your comorbidities or other disease processes such as diabetes, obesity, or kidney diseases.
Oh, that's a lot to think of. So what can Peninsula Home Care do then, or what do you all do for patients? Maybe someone's watching this and they're a caretaker and they need some help.
So typically when we get a patient that has been diagnosed with sepsis, there's a couple of forms that they can take care of it. One's oral antibiotics. So we will come in and actually do med education. We'll tell you when you should take it, how you should take it, what you should look for when taking this medication. The most extreme cases for people that have been in the hospital for several days or even several weeks, they usually come home on IV antibiotics. So our goal is to teach them how to actually give themselves the IV antibiotics on days that we're not there. So, of course, proper hand hygiene, this is what you need to look for. If if the area around the PICC line or midline is red or swollen or inflamed or it's oozing something it shouldn't be oozing, those are things that to look for. So that's what we teach them.
Yeah, and you guys, your whole team, home care is a whole team effort with Peninsula Home Care, and you guys really care a lot about your patients, and you're now serving Sussex County. Tell us a little bit about that.
We are. So we service all of Sussex County and a little bit of Kent. And we deal with everybody. We deal with doctor's offices, all your local hospitals, your urgent care. So we can get people from wherever. So, our biggest thing is we want to make sure that people are well. We teach them to be well. This is what you need to look for if you're on this med or you have this disease process.
Okay, very interesting. I think this is really great knowledge for everybody to know and to have in your back pocket in case unfortunately, if something does happen in the future.
Yes, but we trust and love our friends at Peninsula Home Care. But, well, Christopher, thank you so much for coming in and informing us about this, because it's great information. Where can people get a hold maybe of some more of this information if they need it?
So, a lot of times you can actually call the office. We'll actually educate you on some things in the office. Certain things we can't educate you on because, we don't have that person as a patient yet.
Sure.
But, anything that you need to know, we pretty much have someone in the office that can actually help you with that.
Awesome. Well, Christopher, thank you again, and you come back anytime.
Please.
Thank you for having me.
Thank you.
But for you, don't go anywhere, because there's more CoastLife. You're going to want to miss it, so stay right there.
This segment of CoastLife was brought to you by Peninsula Homecare.